Hello, welcome to Veena Educators. Today we'll start with the bacterial diseases, in which we first start with the cholera. Cholera is an acute diarrheal disease which is caused by contaminated water, which actually spreads through contaminated water, and it causes severe diarrhea and dehydration. And if left untreated, it can be fatal within hours. And the main causative agent which causes this cholera is Vibrio cholera. और ऐसा नहीं है कि once it enters the body तो एकदम से cholera के symptoms appear हो जाएंगे. No, once it enters the body, it took about 1 to 2 days to show its symptoms, which is called as the incubation period. So its incubation period is 1 to 2 days. And once this Vibrio cholera enters to your body, how it produces symptoms in your body? Once it enters to your body through the alimentary canal, it goes towards your small intestine. And once it reaches the small intestine, here it produces toxins. और वो toxins जो हैं वो क्या करते हैं, आपकी बॉडी में enormous amount of water को secrete करते हैं, which is the main reason for diarrhea and rapid loss of fluid. And this is the diarrhea and rapid loss of fluid ultimately cause dehydration. Dehydration which ultimately leads to electrolyte imbalance, and this electrolyte imbalance, it can be very fatal to the patient. It can lead to the death of the patient also if neglected. Here are the various signs and symptoms which appears in cholera are diarrhea, nausea, vomiting, dehydration. These are the symptoms, and the signs you look for: fatigue, irritability, sunken eyes, dry mouth, extreme thirst, dry skin. This is all due to the loss of the fluid. Dehydration is very fatal. Why? Because dehydration में होता क्या है ultimately? बेसिकली डिहाइड्रेशन में जितने भी मिनरल्स होते हैं वो सब लॉस हो जाते हैं बॉडी के, जिसकी वजह से इलेक्ट्रोलाइट इम्बैलेंस होता है और मसल क्रैम्प्स, शॉक लाइक सिम्टम्स ऑल्सो प्रोड्यूसेस. नाउ व्हाट आर द डायग्नोसिस? डायग्नोसिस इज द स्टूल एग्जामिनेशन करेंगे पेशेंट का, एग्जामिनेशन ऑफ द फूड और वाटर जो पेशेंट ने लिया होगा, और बैक्टीरिया का कल्चर करने के बाद ही आपको बैक्टीरिया का पता चलेगा कि विब्रियो कॉलरा है. ओके, next is treatment. Treatment is according to the symptoms. Whatever the symptoms are, that should be treated. Or antimicrobial drugs for 3 to 5 days should be started, like tetracycline, doxycycline, ciprofloxacin. And one more thing, ORT. This is very important, means oral rehydration therapy. ORT is to be given to the patient to maintain this electrolyte imbalance, or you can say to correct the dehydration, which is very important. Next is prevention. Prevention is wash your hands with soap and water frequently, drink only safe water, avoid street vendor foods, eat food that is completely cooked. One thing that is common to the waterborne diseases, that is a prevention. आप लोगों को भी पता है कि waterborne diseases हम कैसे prevent कर सकते हैं, अपने हाथ और अच्छे से सोप और वाटर के साथ धोकर. दूसरा, पानी जो भी पिएंगे दैट शुड बी सेफ, दैट शुड बी बॉइल्ड, और बाहर से जितना भी ये वेंडर फूड होता है उसको अवॉइड करके, बिकॉज छोटी छोटी फ्लाइज जितने भी ये चीज़ें होती हैं, दीज आर द मेन सोर्सेज ऑफ द वाटरबॉर्न डिजीजेज. और खाना वही खाएंगे जो कम्प्लीटली कुक होएगा, या फिर कुछ अगर आप फ्रूट्स या कुछ ले रहे हैं तो दैट शुड बी वॉश प्रॉपरली. दिस इज ऑल अबाउट योर कॉलरा. थैंक यू.